A bloodborne pathogen is a specific virus that is spread through blood or other body fluids. Hepatitis refers to a disease that affects the liver, and the letters A, B, and C refer to a specific virus. HIV, the human immunodeficiency virus, causes AIDS. Hepatitis B, Hepatitis C, and HIV are spread by blood and bodily fluid contact. A person can be a carrier of hepatitis B or C and HIV and not actually become ill for several years. Exposure to these viruses are usually through sexual intercourse and IV drug use. The risk of being infected in the school setting is very low. In the school setting, we treat all blood or other body fluids as if they were infectious. It is important for staff to report any blood-borne exposure. HIV attacks a person's immune system and causes AIDS. Some of the signs and symptoms include weakness, fever, sore throat, nausea, headaches, and diarrhea. A person may not show any immediate symptoms of HIV. Exposure to blood can occur through an open sore. The skin is a barrier, but if there is a cut on the hand, the blood can get into the sore. Another possibility is a bite that breaks the skin. Hepatitis B could be transmitted. A needle stick and a splash of blood to the eyes, nose, or mouth are also potential risks. A person has to have the virus to spread any of the diseases. If you believe you have been exposed to another person's blood in any of these ways, you should report this to your supervisor. Hepatitis B attacks the liver. Signs and symptoms include fatigue, stomach pain, loss of appetite, nausea, jaundice, and darkened urine. Symptoms are sometimes asymptomatic. The condition is present without symptoms. Hepatitis C also attacks the liver. Signs and symptoms include fatigue, weight loss, nausea, and depression. Approximately 60 to 70% of people with hepatitis C show no discernible symptoms of the bloodborne disease. The exposure control plan contains exposure determination, including a list of job classifications identifying employees with occupational exposure. The schedule and method of implementation of methods of compliance, hepatitis B vaccination and follow-up, communication of hazards to employees, and record keeping. The procedures for evaluating exposure incidents. The exposure control plan is accessible to employees. Contact your supervisor for a copy of the plan. Exposure determination identifies and documents job classifications where occupational exposure can occur. The determination is made without regard to using personal protective equipment. Depending upon the results, written exposure determination may contain one or two lists. List 1. Job classifications in which all employees in the classification have occupational exposures. List 2, if applicable, is job classifications in which some employees in the classification have occupational exposure. The tasks and procedures must be indicated. Methods to reduce exposure to bloodborne diseases include engineering controls, work practice controls, and personal protective equipment. Engineering controls reduce employee exposure by either removing the hazard or isolating the worker. Examples of engineering controls include sharps disposal containers, biohazard bags, readily accessible hand washing facilities, antiseptic hand cleaner in conjunction with clean cloth or paper towels, or antiseptic towelettes where hand washing facilities are not feasible. Work practice controls reduce the likelihood of exposure to a bloodborne disease by altering how a task is performed. Examples of work practice controls include washing hands after removing gloves and as soon as possible after exposure occurs. After use, placing disposable contaminated sharps in an immediately accessible sharps container. Avoid eating, drinking, applying cosmetics or lip balm, and handling contact lenses in work areas where there is a reasonable likelihood of occupational exposure. Avoiding storing food and drink in refrigerators, freezers, shelves, cabinets, or countertops where blood and other potentially infectious materials are present. All procedures involving blood or other potentially infectious materials should be performed in such a manner as to minimize splashing, spraying, spattering, and generation of droplets of these substances. Use a brush or broom and dustpan to clean up contaminated broken glassware. Do not pick up glass directly with your hands and dispose of properly in a sharps container. Observe universal precautions. Treat all human blood and other potentially infectious materials as if known to be infected with bloodborne pathogens. When it is difficult to differentiate between body fluid types, consider them to be potentially infectious. Regardless of the perceived low-risk status of a student, consider all body fluid types as potentially infectious. When occupational exposure to bloodborne pathogens remains after engineering and work practice controls are in place, personal protective equipment is to be used. Gloves must be worn when it can be reasonably anticipated that the employee may handle or touch contaminated items or surfaces, or have hand contact with blood, other potentially infectious materials, mucous membranes, or non-intact skin. Be sure the gloves fit properly and remove any rings to eliminate puncturing the gloves. Disposable, single-use gloves should not be washed or decontaminated for reuse. Masks, in combination with eye protection devices, such as goggles or glasses with solid side shields, or chin-length face shields, shall be worn whenever splashes, spray, spatter, or droplets of blood or other potentially infectious materials may be generated. Sharps containers must be leak-proof, puncture-resistant, and able to be closed and labeled or color-coded. They must be located as close as is feasible to where sharps are used. Throughout their use, they must be maintained upright and must not be overfilled. Prior to disposal, the container should be closed and then disposed of per Minnesota Infectious Waste Control Act requirements. The standard requires that warning labels be attached to containers of regulated waste, containers used to store, including refrigerators and freezers, transport, or ship potentially infectious materials, contaminated equipment prior to shipping. Some employees who are likely to incur routine occupational exposure are eligible to receive the hepatitis vaccine. These include the school nurse, anyone responsible for first aid, and others who incur routine exposure as assessed on an individual basis. It should be noted that antibody screening prior to vaccination is the employee's responsibility. The hepatitis B vaccine is a series of 3 injections in a deltoid muscle, immediately, at 1 month, and again at 6 months. The vaccine has mild to no side effects, and it produces only 1 antibody. If the vaccine has been declined and the employee has an exposure incident, the vaccine can be requested and will need to be given right away to be effective. If you encounter an occupational exposure, wash the area of exposure immediately with soap and water. Immediately report the exposure incident to your supervisor. The incident will be investigated and documented by a district healthcare professional. All post-exposure follow-ups are performed by the district's healthcare professional or the employee's healthcare provider. Following an incident, employees receive a confidential medical evaluation and follow-up, including documentation of exposure and circumstances, identification of the source individual if or when possible. The source of blood is tested with consent to determine hepatitis and HIV status, unless already known. Results of testing are available to the employee. Employee's blood is tested with consent to determine hepatitis and HIV status. Training around bloodborne pathogens must be provided at the time of initial assignments to tasks where occupational exposure could occur, or when there has been a change in tasks or procedures that affect the employee's occupational exposure. Training is repeated annually, and records of training are kept on file. Access to the OSHA standard and an explanation of its contents are available through the site facilitator and on the district's website. If you have any questions regarding bloodborne pathogens or any of the information within this presentation, contact your school nurse, your supervisor, or the Human Resources Department.